What's up, everyone? Dr. Dale here, gearing up for our recipe night. We're going to teach our patients and their family members and friends how to cook and eat really healthy. If you're coming, it's like a potluck dinner, so you got to bring a dish. We're specifically doing the dishes out of the Maximize Living cookbook and the Real Food Cookbook by Dr. Josh Axe. It's going to be an exciting night. Then we also have the February 9th, our heart disease workshop. This is something that hits home for me. My father suffered a coronary artery event with about 98 percentile blockage of his coronary artery, so he had to have a stent put in. My grandfather died of heart disease. My grandmother's had several heart surgeries. It's really something that's affected my family. I'm sure it's hits home for a lot of you out there. But something I want to talk about right now, and you can see kind of on the screen, I know the video doesn't pick it up the greatest, but on the screen here behind me I have calcium channel blockers. I'm going to be talking about the dangers of taking medication for heart disease. And I said that correctly, the dangers of taking medication for heart disease. Okay, and we're going to talk real briefly here on calcium channel blockers. Well, calcium channel blockers are things that doctors prescribe for these symptoms right here. Symptoms to treat chest pain, angina, high blood pressure, coronary artery disease, and irregular heartbeat or arrhythmias. So those are things that the calcium channel blockers are used to treat. Here's the way we need to look at those symptoms though. Those symptoms, chest pain, angina, high blood pressure, are warning signs. It means your heart is not functioning properly, your body is not functioning properly. So to take a medication simply covers up that symptom, and that's what these drugs do. So they do effectively reduce chest pain, reduce blood pressure, reduce these symptoms, but guess what they don't do? They don't extend your life. Causes an increased risk in total mortality, increased risk of total death. So you're going to die earlier if you're on these medications. So specifically from heart attack and stroke. This came out of the Journal of Circulation from 1995. These medications were studied, their benefit overall in mortality. Actually, you are going to die earlier if you're taking these medications. The problem is we're taking these symptoms, treating them with a medication that only covers them up, allows the disease process to continue on, doesn't get the person healthy, thus the person's going to die early. So what we need to do is we need to effectively and efficiently get people healthier through proper nutrition, exercise, chiropractic care. The 5 essentials that Maximize Living teaches, that's what's going to get you healthy and well. We're going to specifically talk about what you can do to reduce your risk of total mortality and reduce your risk of dying of heart disease, heart attack and stroke, and ultimately reduce your risk or need for those medications through improved health and longevity. So I'm Dr. Dale Brown here at Marathon Chiropractic. Please do join us February 9th for our heart disease workshop.